Une fois de plus, bienvenue dans cette édition du Morning Call.
Welcome to this Morning Call edition. An Ebola outbreak has been declared in DR Congo after authorities announced the epidemic in Likati, in Lower Uele province near the country's border with Central Africa. According to Congolese health officials working in collaboration with the World Health Organization, 5 samples of blood from 9 of the suspects have tested positive for the virus. The WHO has effected a swift operation to contain the outbreak, with the area quarantined, although there are challenges on humanitarian and equipment medicines.
The World Health Organization reported that out of the 9 cases, 3 people have already died, including one who tested positive for Ebola. The last outbreak of Ebola in the DRC in 2014 killed at least 42 people, and in all, the country has been hit by the deadly disease about 9 times. Following the resurgence of the disease, the public has been urged to be vigilant and to seek medical consultation if they experience fever or other symptoms. There is no approved vaccine to prevent the virus, and there is no approved treatment or cure. Clinical trials of an experimental vaccine are ongoing in West Africa, where more than 11,300 people were killed in the worst ever outbreak of the virus in 2014. The affected countries included Guinea, Sierra Leone, and Liberia.
Let's listen in from our correspondent in the DRC, Gail Mpoyo. Hello, Gail. What is the current situation on the ground since the WHO and the Congolese government declared the Ebola outbreak in the northeast? It was last Friday when the National Health Minister announced the virus in the Likati area in Lower Uele province. It is about 400 kilometers from the city of Kisangani. On the ground, only 9 cases have been reported so far, and 3 deaths are reported. A mortality rate of 33.3%, according to an official report released on Saturday. The first batch of epidemiologic teams, biologists, social mobilization experts, risk managers, as well as water and sanitation specialists have arrived in the area. The Likati area is difficult to access. So in a nutshell, the situation seems to be under control because apart from the initial 9 cases, none other has been reported so far. And what concrete measures are being taken by authorities to contain the epidemic? The WHO country office in the Democratic Republic of Congo is working in close collaboration with the national and provincial authorities, as well as with the support of the Afro-Regional Office based in Geneva and all other partners, to facilitate deployment of protective equipment and field staff to strengthen epidemiological surveillance and control. So the Ministry of Health has taken the necessary steps to effectively respond to this latest outbreak.
Voilà, pour terminer, Gaël, quel est l'état d'esprit? On aimerait bien
savoir. What is the general public mood in this particular part of the country, which is facing a new epidemic 3 years after that of 2014? As you mentioned, DRC's former eastern province is now divided into 4 provinces: Lower Uele, Upper Uele, Ituri, and Chopo. The virus has been detected in Upper Uele, so this is not the first time that the province has recorded this epidemic. As you know, Ebola is a deadly disease that kills many people, and at the slightest contact, people are infected. A situation that puts the local population in fear, especially those in neighboring Chopo province, whose capital is Kisangani. For prevention, the provincial government has taken a number of steps, notably the strong awareness of the population not to panic to know the symptoms of the disease and also how to prevent contraction. There is also the organization of briefings with health and community experts, distribution of leaflets and posters, installation of control points in localities like Pele, Kone, Banalia and Sakaken. There will also be hand-washing points in bus parks for all people coming from Lower Uele.
En provenance de la province du Bas-Uele.